So ladies and gentlemen, before we start the main conference, I'd like to introduce our keynote breakfast seminar with two pre-recorded talks. So don't forget to submit any thoughts and comments through the live chat function in the portal. And for social media, please use the hashtag CHT2023. So our first speaker in our breakfast session is Liz Ashall-Payne. Liz is the founding CEO of Orca Health in the United Kingdom, and Liz is going to speak on empowering children and young people with the potential of digital health.
Good morning. My name is Liz Ashall-Payne, and I'm the founding chief exec at Orca. First of all, thank you so much for inviting me to join today's conference. I'm absolutely delighted to be joining CHT 2023, not least because my clinical background is complex paediatric care. And so this conference is one that's very close to my heart. Today I'm going to be talking to you about how we can put the power of digital health into the hands of everybody who needs it, of course, with a lens for children and young people. So before I get started, I just wanted to explain a little bit about Orca's mission and vision. The reason I wanted to mention that is because Orca is most well known because we assess and evaluate digital health and digital health apps. And of course, that's really important in knowing which technologies are safe and effective. But evaluating technologies is not our mission. Our mission is to get great technologies that are evidence-based into the hands of the people who need it so we can really start to see impact for people and patients. So today's session, I'm going to talk you through some of the opportunities, some of the barriers, and I'm going to also talk you through some examples of how we might be able to work together collaboratively to be able to have that positive impact for children and young people. So the first thing I wanted to do was really talk about the digital health opportunity. So everybody's talking about digital health, and when I talk about digital health, I am talking about health apps, but I'm also talking about digital health at large, so web-based portals, etc. And what we know is that we currently have access to over 360,000 digital health technologies. So we're seeing a massive opportunity when it comes to digital health. And what we also know is that there are more than 6.5 billion smartphones on the planet, which is actually more than the number of people who have a toilet or a toothbrush, which is not a great public health message, but it's a really important one because what we see is that people have access to these smartphones in a way that they don't have access to other things that they may need. What we also know is that every single day 5 million people download a health app, and you can see the global map there indicating the highest users of health apps, and you can see that the United States is the top area, but the UK is the 6th area, which means that a lot of people in our country are downloading health apps. What we also know is that over 90% of clinicians believe that these technologies could help their patients. There is a big but, and I'll come on to that in a moment, but actually our healthcare professionals and workforce are interested in this area and want to engage with it. What we also know is that over 90% of young people aged between 9 and 16 across the UK and Europe use the internet daily. And of course, children and young people are very keen on using technologies. So we have this massive opportunity when it comes to digital health. So, of course, the main question we now need to think about is, well, why are we not therefore embracing these technologies? Well, we have a number of problems, but the biggest problem that we have is trust. Most people don't know which of the 365,000 technologies they can trust. And to be honest, that concern is not unfounded. Orca have assessed over 25,000 technologies and health apps, and we've found that only 20% meet the quality threshold that you would expect. And what's really sad about that is for the 5 million people every day who download a health app, most people are finding unsafe, unregulated and poor quality products, meaning that we've missed the opportunity to have a positive impact for those people. So, what do regulators think when we talk about this trust issue? Well, this is a quote from Johan from the MHRA. And Johan stated that digital mental health tools offer millions of people vital support and guidance. And of course, what we know when it comes to children and young people is that we're seeing a massive increase in children and young people experiencing challenges when it comes to their mental health. And we know that the waiting lists are quite significant. But what MHRA are also saying is that there are some regulatory complexities, and these products need to be regulated to understand safety and effectiveness before we start to distribute them. And that's really difficult. And the reason it's difficult is because products change and update all the time. Regulations and standards are changing all the time. And so too are the people who need access to these products. So of course we need to regulate and ensure safety and effectiveness. But the question is, how do we do that? Well, Orca, as I said at the beginning, are very well known for assessing and evaluating technologies. But of course, Orca's mission isn't to assess and evaluate. We want to get great technologies into the hands of people. And I want to share with you a model of thinking, which actually is thinking on which Orca was founded. And I wanted to share this with you because I think it's really important to think about having a system of building trust and then distributing and helping people have access to trusted technologies. So bear with me while I just go through this analogy. In the world of medications and drugs and pharmaceuticals, we have a very clear process of building trust, distributing and activating people to use safe drugs to help health outcomes. And in order to do that, we have a very clear systematic approach, which first of all builds trust in the drugs that are out there. And that trust starts with the evaluation and assessment of those drugs, in this country, first of all by MHRA, and then by NICE, who assess the evidence of effectiveness of that drug. And before a drug gets to market, they have to go through that process. What then happens is we then raise awareness in healthcare professionals or would-be prescribers in the drugs that are safe. And so would-be prescribers are trained and those drugs enter into the British National Formulary. We then have access to those drugs and we provide access to prescribed drugs through a prescription infrastructure, whereby an e-prescription is sent so that the system knows what drugs have gone where, to whom, and whether that person went and collected the drug. And of course, wrapped up in all of that is governance and reimbursement. So if we find a future fault with a drug, we know what drugs have gone to whom, did they collect it, and we can do a recall. And ultimately, that is what we need for the world of digital health. So in the world of digital health, we need to first of all build trust. We need to know which products are safe. And here in the UK, we have something called the NHS DTAC and the NICE Evidence Standard Framework. Internationally, we have other digital health assessment frameworks, which I'll come on to in a bit. But by assessing to those standards, we can build trust in knowing which products have met those compliance requirements. What we then need to do is train our health and care professionals and workforce in knowing which of those technologies are safe and effective. And we then need to provide access. Now, I'm going to give you an example later about how Orca are supporting access through digital health app libraries so that people can find safe technologies, but more importantly, digital health formularies. And a formula enables a healthcare system and its workforce to pick and recommend via text message the best product to their patient. And what that means is that we now have a system to monitor what technologies have gone to whom. We now know what's been converted and downloaded, and this system of building trust continues to happen every time the product updates and changes. And this is a system that we really need to think about carefully. Just assessing products isn't enough. Just training isn't enough. Just providing access isn't enough. We need a whole system. So what I wanted to do was just share some insights into how people are starting this journey by building trust. So I've already mentioned that here in the NHS, we have the NHS DTAC, which is an example of a digital health assessment framework. So this is the criteria by which if we assess a product to it and it passes, we can trust it. But globally and internationally, there are lots of these digital health assessment frameworks, and I've shared here a number of them, but they're from New Zealand to Iceland to Germany to America. And these digital health assessment frameworks have been predominantly built by national organisations who want to set the criteria so that we can understand what good looks like and assess to it. Now, what's really interesting is across these digital health assessment frameworks, there is a huge amount of convergence. And what I mean by that is people want to know, organisations and countries want to know the same questions. And that's great because hopefully then we can think about how we can share the knowledge that the world has on which products are safe and effective. This next slide I'm going to show you is very busy, but bear with me while I just talk you through this. What we've tried to do at Orca is look at all the questions that organisations and countries are trying to set as criteria. And what we can see is the different verticals. So the first vertical is the American Digital Health Assessment Framework. The second is the European. The third is the NHS, and so on. And what you can see horizontally is up from the green section and the pink section, they're the question sets that everybody wants to know the answer to. That accounts for over 350 questions. I know visually it doesn't look like that, but it is a significant bulk of the compliance questions that everybody wants to know. And this is predominantly looking at clinical assurance, usability and accessibility, and data and privacy. Now, on top of that, there are some differences. So you can see, for example, in that third vertical for the NHS DTAC, they have some enhanced data analysis, some enhanced security and technical stability questions, and of course, the legislative clinical safety DCB 0129. If a product passes that, they achieve NHS DTAC compliance. But what's really interesting is even at that dark blue enhanced level, you can see that there is growing convergence globally. So if a product achieves NHS DTAC compliance and then decides that they want to go into a Canadian marketplace, you can see that there's only one additional criteria. If a product then wants to move over into the German DiGA, they've already passed all compliance requirements. And the reason we're really passionate about this is because, as I said, our mission is to get great technologies into the hands of the people, children and young people in this instance, who need it. And so if we can quickly get through assessing and sharing compliance data, we can really start to focus on distributing great technologies and activating people and patients to use these amazing technologies. Now, one of the things to mention is, of course, just knowing which single point solutions are safe and effective is not the answer. We know that there are lots and lots of digital health technologies and health apps that could help children and young people. And I've given an example here for children and young people's mental health. But of course, what we also know is one single point solution will never be enough for all children at every point in a pathway. And so what we've been doing predominantly in the NHS, but also internationally, is working with healthcare systems to understand pain points in the pathway and also identifying points in the pathway where a clinician or a healthcare professional has a touch point with a patient. What we also then do is, based on the evaluation of evidence, identify opportunities where a health app can help to alleviate a pain point and then suggest a product at that point. And in the same way that when we talk about drugs and pharmaceuticals, we don't have one drug for every person across a whole pathway. And it's the same with digital health apps. So if, for example, we have 3 young people in front of us all experiencing anxiety, but what I didn't tell you was that one of those young people are 8, another is 12, and another is 17. And what we therefore need are different technologies dependent on the different age groups. But more important than that, what I didn't tell you was that the first person has a hearing impairment, the second has a visual impairment, and the third has a cognitive impairment. Plus, the first person has an Android phone, the second has a Apple device, and the third needs to use a web-based portal. And therefore, what you can start to see is having one product for a whole pathway is never going to be the answer. We need to recognise that different products will support different people and different children and young people across a pathway. Equally, if somebody's new to a diagnosis versus has been living with a diagnosis for a long time, they may need a different product. And so thinking through digital care pathways is absolutely critical. It is so important. But of course, so too is educating and training the health or care professional who has a touch point with that child or young person so that they understand this and know which product they should be recommending at a certain point in the pathway. This digital care pathway work has been completely revolutionary in being able to have an impact across a whole pathway. And the other thing to know is that by having a range of technologies across a pathway means that we see the return on investment for the whole pathway rather than a single point solution that will not be able to support everybody going through it. So how have we been able to support healthcare systems to do that job? Well, in the same way that in the drug analogy, we have on general sale drugs where we can go to a supermarket or go to a pharmacy and buy certain drugs to help manage our own health or our child's health. And we also have a distribution of drugs which are prescribed. That's exactly the mirror image of how Orca are working with healthcare systems. So we create digital health app libraries which are promoted to a target audience. Now, of course, when we're talking about children and young people, that promotion may happen through schools or education. It may also happen through children's groups or where parents are, so that people now know where to go to find safe, effective tools to help themselves or their loved ones. The formula, on the other hand, is about showing the pathway, providing education training to would-be prescribers, and then supporting them to be able to prescribe or recommend via text message the best product to their patient or their patient's family or carer via text message. And this sounds like a really simple thing to do, but the reason for doing it is so important. First of all, if you recommend via text message, what you know is that the right technology has got into the hands of the person you want to have. And second of all, because the system is continuously checking for ongoing compliance and quality, if a future fault is found, a recall can be established. And particularly when we're talking about children and young people in vulnerable positions, this is critical. The other thing that's really interesting in both of these instances is being able to search and filter according to cost is important. So when you look at the Digital Health App Library, one of the things that we found from talking to children and young people was that they got frustrated because they were downloading products that they thought could help them and did start to help them. But after 5 days, the product asked for in-app purchases to continue the access. The reason that was a challenge for children and young people was because they didn't want to ask for money and didn't have access to money. So when they're searching and filtering for products on the Digital Health App Libraries, we also have a filter which says entirely free, in-app purchases or paid for. And what that means is the young person can search and filter for the right product for them. And that has been really impactful. Now, the consequence of this work has meant that we've seen a reduction in crisis for children and young people waiting, but really importantly, we've seen the post-discharge, a continuation of the outcomes achieved, meaning that revolving door doesn't happen as frequently. So the impact for a whole system is huge. It's just working through knowing which single point solutions are safe, dropping them into a pathway, and thinking through activation and distribution in a very clear way. And for me, my big call to action to this group is, what if we worked collaboratively to create a home for global digital health assessments? And what I mean by that is having a warehouse of products specifically for children and young people that is in a warehouse, so we know that we have a trusted repository where we can go to find these technologies. And in doing that, we can maximise efficiencies by using common requirements and standards and share in that compliance data so that we're not all duplicating effort in testing these products. And then, of course, what it means is that as healthcare systems, we can focus on the distribution, prescription and recommendation operations to get these products into the hands of children and young people who need them today. I hope that that's been a useful introduction into evaluation, distribution and activation. If anybody wants to reach out to have a conversation after today, please do. You can see that there's an email there that you can contact, and of course you can reach out via social media channels. Thank you so much for your time.
Thank you, Liz, for an excellent opening presentation and for the hugely important work that you and OCHA do. And that was a fantastic call to arms at the end for us to work collaboratively to support digital health innovations for children and young people.